why don't we begin with prayer first, and then I'll introduce the speaker. Let's bow our heads. Dear Heavenly Father, thank you for your love and your grace, your goodness, and the provision you've made ahead of time from the time of creation for life and health that you desire each of us to experience in relationship with you. And I pray that you'll be with us tonight, help us to learn more about how we can help others understand that love and the fascinating mechanisms that you put in our body to function on this earth in spite of sin, and your grace for saving us. So pray this in Jesus' name, amen. Well, tonight we're again privileged to have Dr. John Kelly here, who I don't know if any of you may perhaps missed his lecture this morning on epigenetics. It was fascinating. If you did, you'll have to go back and listen to it on the recording later. Dr. Kelly is a leader in the lifestyle medicine arena. He has degrees from Loma Linda, MD degree, and MPH, finished a preventive medicine residency. His residency was finished in 2004. He also, in that same year, received AMA's Excellence of Medicine Award for leadership and involvement and founding. He was also one of the founding fathers of American College of Lifestyle Medicine and its first president. He's done research, had appointments in lifestyle medicine and various things, and been the medical director for several different lifestyle centers across the nation. We appreciate him giving of his time here for helping us learn a little more about that. John, would you take it from there?
Yes, thank you so much. Let me share my screen. I'm going to start off by sharing the PowerPoint. Can you see the slide now? And you're able to hear me okay, are you, Cindy?
Yes.
Okay, good. So, you know, for me, it's it is past the Sabbath just a few minutes ago, and I understand, of course, I appreciate that it's not quite Sabbath where you are. So, but I'm very comfortable actually sharing this message on Sabbath, as you'll see why. I wanted to say, if I might, just a couple of things about the theme, saving more than bodies, righteousness by faith, and the health message, as I sort of start off this, which, as I say, for me, a Sabbath message. You know, righteousness by faith, that's our understanding, as I understand it, that's our understanding that all of our righteousness is as filthy rags, that the only source and method of human righteousness is really by faith in Christ. And he purchased the legal right to forgive us and to our sins and to transform us back into the likeness of God. So, and the health message is a term that historically, as I understand it, we've used by Adventists to refer to the counsels on health and healthy living given by God in the writings of Ellen White, which were specifically given to help and enable us to present the three angels' messages in the context of the everlasting gospel. And so I myself was not raised Adventist. I became a Seventh-day Adventist in my 20s, which is a miracle in itself. For a young man in his 20s is usually pretty immune to the gospel, but thank God the Lord found a way to reach my heart. And ever since I was converted to the present truth, I have embraced the health message. I totally transformed my way of living, every diet, everything. And I feel it a great privilege to have gotten an education in God's medical school, Loma Linda, and I'm privileged to be serving the Lord as an Adventist physician. So the health message, of course, is important for physical health and healing, but I believe the real reason behind it, its overarching purpose, is spiritual health and readiness for Christ's imminent return. We need to embrace the health message for our spiritual health as well as our physical health and the trials that this last generation, if we're privileged to be the last generation, that we will pass through. So I think it's critical that we present the health message as part of the everlasting gospel, because it wouldn't be appropriate to share a message about Christ's soon return without also sharing the health message, which is a part of the preparation for that. Well, one thing I want to say as we enter into this talk tonight is something about the health message and the modern healthcare. You know, and again, these are all my opinions. I'm willing to, when I get into the talk itself, I will be citing science papers. But in the beginning here, I just want to share some perspective, and it's my own personal experience. But I believe the present Western model of healthcare is too often antithetical to God's health message. You know, whereas the health message is based on a loving conformity to God's benevolent design and its laws of health and well-being, modern medicine is based largely upon indulging personal appetite and then treating the resulting symptoms of disease as the body deteriorates under the burden of continual violation of God's laws of health. And without question, modern medicine has learned how to perform technological wonders of repair. But actually, we've utterly failed at producing a healthy populace. Obesity is accelerated, and diabetes and metabolic syndrome follow in its tracks. The world is in dire need of God's health message, the message that he has entrusted to us as his remnant people to share with the world. And I believe, my colleagues and friends, this is our calling. I believe this is our privilege in our work as God's medical and pastoral ministers. We're called to present the health message with the eternal gospel to prepare the world for Christ's soon return. And I pray that we will embrace it and be blessed by it. So our topic for this presentation tonight is lifestyle and hydrothermal therapy for COVID-19. A good subtitle, I think, might be using God's health message to address the COVID-19 pandemic. As we think about using the health message to address COVID, I'd like to remind us all of God's calling for medical ministry. And I want to do that by sharing something here. 2 contemporary medical reform models. I don't know if you've ever thought about this, but I find it a fascinating study, and I'm still working on it and learning from it. But here in Medical Ministry, page 27, paragraph 2, is from a letter in 1898. Ellen White wrote, "The light was first given to me why institutions should be established, that is, sanitariums, were to reform the medical practices of physicians." Did you realize that? I know it took me some time as an Adventist before I came across this statement and realized this calling, but it energized me, and I was excited to realize that what we've been called to do, and all of God's calling or biddings, our enablings, was to reform the practice of medicine. But it's interesting, and I don't find there to be any coincidence in the fact that the Flexner report was published about a decade later in 1910. And what we read is that from Duffy in the Yale Journal of Biology and Medicine was that the Flexner report of 1910 transformed the nature and process of medical education in America with a resulting elimination of proprietary schools and the establishment of the biomedical model as the gold standard of medical training. This transformation occurred in the aftermath of the report, which embraced scientific knowledge and its advancement as the defining ethos of a modern physician. You know, historical records trace the ensuing effects as the AMA adopted Flexner's reforms and the fledgling College of Medical Evangelists, established to train sanitarium workers, struggled to survive, much less thrive. But the telling of that story must be held for another time and another presentation. Suffice it to say, as the dust settled, we saw the disappearance of sanitariums and the transformation of the College of Medical Evangelists into present-day Loma Linda University Health. And again, I leave it to you to judge how these reforms have fared and which have prevailed. I think there's some merit in each, but I find, as I say, modern medicine oftentimes antagonistic almost to God's health methods. So with that context, let me share our learning objectives. To understand the typical comorbidities associated with poor COVID-19 outcomes and the beneficial effects of lifestyle change relevant to COVID-19 treatment. Number two, to understand the beneficial effects of hydrothermal therapy on COVID-infected patients. Three, to know some of the simple but effective hydrothermal treatments that can improve COVID-19 outcomes and viral infection in general. And four, know the typical results of a lifestyle medicine immersion program that was combined with hydrothermal therapy. So, our first learning objective. So what are the prevailing comorbidities of those who contract COVID and particularly who require hospitalization? From the Morbidity and Mortality Weekly Report of April 2020, we see that it's type 2 diabetes, chronic lung disease, cardiovascular disease, obesity are some of the top ones. And in a word, we might say just chronic diseases, right? And probably this is not a surprise or anything new to most of us. You might find a couple of these statistics very interesting. Here's a report published in March of 2021, just a month or so ago. And they were looking at the relative risk of, you can see the non-hospitalized were 40 in this study, and 20 were hospitalized, and they were looking at the prevalence of various conditions and how this was associated with hospitalization. And what we see is the relative risk for those with diabetes was 5 times the risk of needing hospitalization. Heart diseases we can't calculate because there were none that were with, and those that were not hospitalized, none of them had heart disease. Hypertension we can calculate, there was a 1.33 relative risk, and other conditions, there was about a 12 relative risk of 12. So quite a remarkable impact of chronic diseases on the impact of COVID and the likelihood of severe disease. But some good news is that the lifestyle medicine studies reveal that intensive lifestyle interventions can arrest and even reverse most, if not all, of these chronic diseases that are risk factors for COVID. The Ornish-Geminal study, which we looked at this morning, showed that intensive therapeutic lifestyle change programs can alter gene expression in a matter of days or weeks. A fasting mimicking diet, which we also looked at this morning, can not only alter gene expression, but induce beta cell neogenesis with reversal of type 2 diabetes and type 1 phenotype in mice, and had similar in vitro effects in human pancreatic tissue. A very low energy diet, which we're going to look at, we haven't seen this yet, has been shown to induce remission in 46% of type 2 diabetic patients in a general practice clinic setting in the UK, with 86% remission rate in those achieving the target goal of 15 kilogram weight loss in the first year. And then I'll show you some of my own in publication randomized study data. Some of this is from the Marshall Islands and some of the data I've collected from residential centers. But we find that a 10-day intensive intervention can decrease fasting glucose and fasting insulin both. So we're obviously making dramatic changes in insulin resistance. So let's just look at first the direct study and the look ahead study. So results from these two interventions for type 2 diabetes reveal an important point that I want to bring out early, and that is that the importance of adequately dosing lifestyle interventions. So the direct trial which you see on the left here with the, what we would call those tan or light orange bars. That chart is from the direct trial. The citation there is published in February of 2018 in Lancet by Lean et al. From the UK. They used a very low energy meal replacement to achieve a weight loss, a target goal of 15 kilograms, followed by a reintroduction of food over a period of 4 or 5 weeks with emphasis on weight maintenance. And then the mean remission rate was 46%. That's the over on the left-hand bar. The average was 46% in the first year. And there was, you can see a dose response relationship then on the bars going to the right across there. So those with less than 5 kilogram weight loss had a 7% remission, those 5 to 10, 34, and so forth. And like I say, it's almost a linear dose response relationship with 86% in those who had 15 or more. Well, now the look ahead trial, which was published, that's the second citation here by Greg et al., published in the Journal of American Medical Association in 2012, the end of 2012, December. They had 4-year results, and the direct trial only now has 2 years, and I only showed the first year here because this is an older chart, and I need to update it. Since I created this slide, I have now 2-year results. But at any rate, you can look at, in the look ahead, they had only 11 to 12% remission rate, and that was partial or complete. They counted a partial remission, which means they went from being diabetic to pre-diabetic levels, or complete, meaning they went to less than pre-diabetic levels of blood sugar. And they're what they called an intensive lifestyle intervention. They had a 2% remission rate with diabetes support and education, which is the ADA recommended treatment. Obviously inadequate. I mean, to me, if nothing else we can get out of the look ahead trial is that we need to change the American Diabetes Association recommended intervention for diabetes. And but the difference between this, so I've added here, I don't know if you can see my pointer, but in the middle of the slide, I added the look ahead intensive intervention and the American Diabetes Association diabetes support and education results. And these are abysmal compared to what was achieved with the more intensive dosing of lifestyle change in the direct trial. So, there's a good reason that baby aspirin is not used to treat headache, and 650 milligrams of aspirin is not used for secondary prevention of heart attack. The dosing of any medication must be matched to the desired and necessary treatment effect. So, so what I want to do now is I want to take a look. I'm not going to look at all these numbers, but I just want to show you an overview of lifestyle medicine clinic results. A convenient sample of 55 patients from an 18-day intensive immersion program that I was medical director for in the Black Hills for about 3 years. And this is just a convenient sample for any who may not know. It simply means every patient that came through the doors during this period of time. So it's not randomized, but it's not a select group either. It's all people that went through the 18-day program. And there was you can see there were about 55. We don't have, numbers 55 on everybody, because some of these, they're subsets like, but that's not the part I want to look at. I just wanted to, in this handout, you'll have that, but I want to actually go and look at some specifics because I want to save some time here. What produces dramatic biometric changes is intensive lifestyle change. And so here what we have is the system, my background before medicine was in IT. Medicine is a new career for me. You mentioned, Stuart mentioned that I had the privilege of getting the AMA Excellence in Medicine Award as a young physician. Yeah, I was 55 years of age when I won the AMA Excellence in Medicine Award as a young physician. So medicine is a second career, but my previous one was IT. And so I have, I can't help it. I just naturally develop software help with whatever task I'm working with. So as a physician, lifestyle medicine physician, I've created a EMR that collects and analyzes all this kind of information. So we have here the servings per week of cholesterol foods, of high fat foods, etc., amount of water drinking, how many were having big suppers and so on. So here's basically a set of trigger measures similar to what the CHIP program used, because again, I used that curriculum as my core curriculum for intervention programs. And anyway, the bottom line is, if you look over on the right-hand side, the percent change, there's dramatic drops in these things because we're serving the people, the patients, the health guests, we're serving them the meals. And so of course they're unless they are driving off campus and going somewhere to McDonald's, they're getting their what we serve them. But exercise is also changing and sleep is changing. So all of these things are measured and we show dramatic changes. Well, that's what produces these dramatic changes in the measures. So I want to just look at the diabetes measures. And you can see a almost 3% change in weight. BMI, of course, the same. The waist, I have not quite 2% decrease in waist circumference. The glucose, the average overall went down by 9.7%, just over 10 milligrams per deciliter. But those that were diabetic, 126 and above, had a 30% drop in their glucose, fasting glucose. At the same time that's going down, the insulin overall went down by 25%. And the homeostasis model of assessment of insulin resistance dropped by 33%. So we see dramatic reversal taking place in diabetes and related measures when the interventions are intensive enough. Here we have the results from the metabolic syndrome and heart disease that also improve. So here on the left, we have all of the criteria that would for determining whether someone has metabolic syndrome, and you can see improvements. And then I'm just going to drop down and look at the number of individuals. So the number that had 3 or more criteria started off at 16, but at the end of the 18 days, only 9 met those criteria. So we had a 44% drop in the number of people with metabolic syndrome. There was 7 that began with 4 or more. And it's obvious that since there were none with 5, that had to be 4. And they dropped to only 3. So that's a 57% drop in those that had 4 criteria. Over on the right, we have heart disease. And so we're looking here at cholesterol, triglycerides, etc. And the high sensitivity, I want to call your attention to the HSCRP, high sensitivity C-reactive protein, dropping by 30%. But if you look at the subset of those who had started off with greater than 3, it dropped by 44%. And again, statistical significance is high on all of these measures. So point being that we can make dramatic improvements in a short period of time. I just want to show this because the biggest changes actually occur not in the blood tests, but in the Beck depression scores and standard function. Notice here that the Beck score, well, that's here under, I'm not sure why I have these reversed. I'm sorry, I have the Beck first in the table, but last on the chart. But at any rate, this is the average, all people that took, and we only repeat the score for those that had 13 or greater, indicating depressed. And what we found was a drop of 49%. But when we look at those here that started off with a score over 19, so they had moderate to severe depression, we had an improvement of 69%. And tremendous, you probably know this, and probably the most notable researcher on this is the Neil Nedley's Depression Recovery Program. But the fact is, any effective lifestyle intervention program makes dramatic improvement. And over here on the left side was the standard function. So the overall scores went from 58 to 72, a 25% increase. The ideal is 100. is a perfect score on the SF-36. Those that started less than 75, which were moderate impairment, they had a 76% improvement. You can see those almost achieved the same level of score as the overalls. So it's highly effective intervention, lifestyle interventions. All right, let's look at our second learning objective now, to understand the beneficial effects of hydrothermal therapy on COVID-infected patients. So let's turn to look at some studies on this in COVID patients. Studies reveal a strong innate immune response is necessary to clear the virus. We'll look at that. With COVID, the innate response is weakened or delayed, especially in those that need hospitalization. And SARS-CoV-2 hinders early cytokine production, which, interestingly enough, then can lead to a subsequent cytokine storm when the hindering effect is overcome by the immune system. It's like it overshoots the mark and produces this cytokine storm, which can be actually deadly. So let's look first here at the study, an article published last month by Bochat et al. And they look at the innate immune function versus the adaptive function. And I just want to read from the abstract here, and it's on the screen there. But the clinical course in COVID-19 indicates infection control in asymptomatic patients with mild disease is probably due to innate immune response. And the logic there is that the effective adaptive response would not be expected to occur until 2 to 3 weeks after contact with the virus. But in these individuals that have asymptomatic infection, it clears in 7 days or less in many cases. Next point in there in the abstract is antiviral innate immunity has both humoral components and cellular. So humoral would include the complement and coagulation, fibrinolysis systems, soluble proteins, and so forth. I won't read all of that. The cellular components include natural killer cells and other innate lymphocytes. The failure of this system would pave the way for uncontrolled viral replication in the airways and the mounting of an adaptive immune response, potentially amplified by an inflammatory cascade. And then their bottom line, severe COVID-19 appears to be due not only to viral infection, but also to a dysregulated immune and inflammatory response. And again, it's the failure of the innate immune system to act quick enough. The innate immune system here, as they show in this figure in that article, is activated first, you can see there, and then the adaptive response requires generally 10 or more days for that to really get underway. This figure 1 is a very interesting point, and I'd like to just blow that up so you can read it a little easier. And it says, unlike the normal antiviral response with increased interferon type 1 and 3, and with it the activation of genes stimulated by interferon in adjacent cells, thereby increasing its antiviral defense, the coronavirus has mechanisms that lower this antiviral innate defense mechanism by interfering with interferon production and its effects. In addition, chemotactic molecules are released in a viral infection that attract macrophages, natural killer cells, and neutrophils. This reaction is not fully achieved during early infection with coronavirus, so the initial innate immune response appears incomplete and slow. After this first innate response, adaptive immunity is triggered via activation of dendritic cells. So they're just describing here in this article the innate immunity and its importance with the COVID infection and the comparison of asymptomatic patients to those who are not. So now let's take a look at the hydrothermal therapy, okay, in COVID patients. Some studies on that. Hydrothermal therapy has been shown to strengthen innate immunity, the very part of the immune system that helps to quickly clear this virus. And reports of hydrothermal therapy, fermentation, used in the Spanish flu according to the article, reveals great benefits. And they cite the Life and Health May 1919 issue for that. So let's look here at a study by Zellner et al. About human monocyte stimulation by experimental whole body hyperthermia. This is from an article published in 2002. And what we read here is that the thermal effect of fever, an evolutionary conserved acute phase response, has been associated with better survival and a shorter duration of disease in cases of infection. Molecular consequence of beneficial fever response is poorly understood, and so that's why they were doing this study. To determine the influence of hyperthermia on human monocytes, important for recognition and elimination of pathogens, 12 healthy volunteers were immersed in a 39.5 degrees Celsius or 103.1 degrees Fahrenheit hot water bath to increase their body temperature. It goes on, expression of endotoxin receptor CD14 and complement receptor CD11B increased after the hot water bath, and it was a statistically significant difference in these 12 individuals, a small number of subjects, whereas the expression of selectin CD62L, which mediates initial attachment of leukocytes at the endothelium during inflammation, was downregulated after hyperthermia. So comparable changes in monocyte receptor expression were observed after in vitro hyperthermia. Furthermore, 3 hours after in vivo hyperthermia, the response of monocytes to endotoxin was enhanced in an ex vivo lipopolysaccharide stimulation assay as expressed by a greater tumor necrosis factor alpha release. We conclude that the thermal effect of fever directly activates monocytes, which increases their ability to respond to bacterial challenge, also to respond, as we now know, to a viral infection. So the bottom line is that whole body hyperthermal therapy strengthens the immune function, and this is we find in the literature. Now, this is an interesting, I want to quote from the article by Lorena Linneman, and it's there at the top of the slide. During the 1918 flu pandemic, hydrotherapy with hot wrappings on chest and abdomen soaked in boiling water thrice daily with the patient wrapped in a blanket resulted in 300% increased survival rate. And that was a quoting from the article, which was actually citing the Life and Health May 1919 issue, Dr. Elliott's report. So now our third learning objective. I'd like to know some of the simple but effective hydrothermal treatments that can improve COVID-19 and viral infection outcomes. And so we want to look at some of the most effective hydrothermal therapies. And this would be a Russian steam bath, chest fomentation, but also contrast shower and a prolonged hot foot bath. You know, a hot foot bath is a remarkable treatment that depending on how long we do it, it can have a local effect or it can have a systemic effect. It can actually be prolonged so to the point of actually causing exhaustion. So it's quite a remarkable treatment, even though it's so simple. Let's look at these individually. So the Russian steam bath cabinets, here we have on the left, the old versus in the middle and right, we have the modern fiberglass units. These are really easy to use. My wife and I are fortunate to have one of these, actually two now. Someone's given us another one. And they are amazingly effective. However, many such treatments must be done at home rather than at a clinic or center. And so fortunately, the Semper methods can also work just fine, as seen in these two photographs of using chair and a covering and a steam, something to generate steam underneath. I've done it with anything from a electric frying pan to a instant pot, any number of things that can produce steam can work well. And then there's fomentation. So I've got on the left then and on the right now. Basically, the methodology is still the same. A modern application is still using the same technique, illustrated with this little schematic drawing, where we have cold compresses on the head and sometimes on the neck as well, but certainly on the head. You see there's a modest temperature heat pack on the back. This is not a really hot. It needs to be a modest temperature. But then we have the fomentations on the chest. And these would be changed 3 or 4 times, 5 or 6 perhaps, in a vigorous treatment during a treatment. Cold friction, but very cold water friction between each change of the fomentation on the chest. And then you see there's a foot bath, and the patient is in a warm bed. Again, the foot bath and the fomentation under the back is to heat the body, keep it warm, not so much trying to where the heat is really applied more from the chest fomentation. Anyway, and then you see up in the top right, a typical fermentation pad. These are still available, and they're designed to hold heat and moisture and avoid burning the skin. So you want a pad that doesn't drip hot water onto the patient, holds the heat and the moisture. The contrast shower. Here, a little simple graphic, 3 to 4 cycles, 3 minutes hot, followed by a minute of cold. And what we're looking for is high volume shower head, ideal. I like this little picture here. The 3 minutes of hot looks real nice. The cold, if you do these, you know, it'll get you going. You'll be glad when the minute's up. All right, so now I want to look at a 4th learning objective, which is to know the typical results of a lifestyle medicine immersion program that's combined with hydrothermal therapy, because I'm so happy that we don't have to wonder about this, what the effects are, because we actually did this in February at the Village Church in Berrien Springs. The church conducted a 10-day lifestyle immersion program in the facilities at the church. It was volunteer staffed, and it was all church members. All the health guests were church members, and I believe all of the trainees, yes, all the trainees, there were 12 of those, which included 3 physicians and 3 RNs, were all Seventh-day Adventists. There was a professional observer who was not Adventist, and he was just amazed at what he saw and learned. Was actually a Nepalese physician that was coming for professional observing and training. So the 10-day outpatient immersion was from 7 in the morning till 7:30 in the evening. It was a full day every day. We served all meals. We did all exercise, all shipped video lectures, live lectures, had guest presenters, routine daily exercise activities. We used what we talked about this morning, early time restricted feeding. So, and I typically use a pattern of the first 3 days, we do a smoothie at supper time. So they have something, but they know from the beginning that it's only going to be 3 days and we're going to go to no supper. And what's exciting is if I have time, I've got a actual testimony by one of the health guests, physician, and she surprised herself that, and I hear this all the time, I don't know why, but I'm not hungry in the evening. It's working wonderfully. And we had, of course, multiple hydrotherapy treatments daily. Part of the reason that we had these treatments was because it was a training event. But let me show you what the typical daily activity schedule for the first week of the program is shown here. It was a busy, full daily schedule, but it did include periods of time for rest and other activities. The details are not important, just that you can get the sense here. This shows them finishing up at 8:30, but we ended up, what we did was oftentimes we let them go. We didn't schedule many appointments at 7:30, and so they pretty much were finished up by then. Now, oops, I went too far. So this is the second week. Here, you can see graduation occurred on the Thursday, the second week. I had a graduation and a banquet, and then they all went home and had time to get home before Sabbath. Now, this was also a training program, a training that accompanied this. And the course prepared the trainees to perform these hydrotherapy treatments on the guest, and it's summarized here that they completed about 20 hours of online coursework. That was life and health videos and some free YouTube videos that we had vetted and found online. Then that was followed by 3 days of hands-on training and practice. And the trainees then during the immersion assisted and performed at least three or more of each of the 4 hydrotherapy treatments. And plus they were putting poultices on, charcoal poultices. Sometimes we use a few other raw plants for poultice, but the vast majority were charcoal. The performance was graded by the mentor therapists who were volunteers that were responsible for the therapies. The trainees had quizzes and exams that they took during the program, during the online and the in person, and they had a 2-hour comprehensive final on the last day. They sweated that, but they did really well. I'm happy to say that every trainee was able to learn and perform at a satisfactory level, and all 12 graduated with a score of 75% or greater. So that was a success. Here's what the that looked like. So this is week 0, the week before the immersion, and Thursday and Friday were training days. Sabbath was relaxed, and then Sunday before the immersion, there was some more training. So that's why we say 2.5 days of training. So what were the results? Well, they're summarized here graphically, and then on the table shows the statistical significance of these changes. So you can see weight, blood pressure, glucose, and each one is showing the percent drop. Again, in this group, the insulin dropped 31%, and while the glucose also dropped by 6.4%, and some people had to, of course, cut back on their medications. So it's just amazing how intensive lifestyle changes are so effective at reversing type 2 diabetes metabolic dysfunction. The cholesterol dropped, LDL dropped even more, triglycerides and so forth. Here again, the high sensitivity CRP dropping 33%. And what's amazing, this was a 10-day ambulatory immersion done in a local church, and we had essentially the same results as I showed you from the 18-day residential program. So the Lord really blessed. And the SF36 again was improved nicely. The Beck drop, this is only for those who had a Beck score, showing mild or greater depression, but there's a 49% drop there. So you can see all of these numbers in the table showing one of the things here is the total cholesterol to HDL, about the middle of the chart. There was a 5% drop. So the risk, even though sometimes the HDL goes down with an intensive intervention until the exercise brings it back up, the actual risk drops. So we don't have to worry about some a temporary change in the HDL. Many of you probably already know this. So now I'm going to see if I have, let's see, we have about 15 minutes. I want to see if I can share this testimony by Dr. Loida Medina. I'm not going to have time to do both of these, but it's on YouTube, and you can, it's in the handout. You'll be able to see it if you want to listen to these. The Village Church does a mission program. So I'm going to stop sharing. I'm going to share my other screen here. And tell me, Sandy, be sure to let me know if you can hear this.
It was a life-changing one for me. At first, I
Okay.
did not want to come in and to register because
You had to change your microphone.
this program is a life-changing one for me. At first, I did not think I should come in because I thought I knew what I was suffering. I thought I knew how to take care of myself, and we should, right, as physicians. But I was encouraged by my friend because I have been struggling with the high cholesterol, and I did not want to take medications. With all the pills that we're taking to increase our immunity for COVID, I did not want to add 2 or more to those, okay? So I thought, okay, I'd like to try this. Before that, I was taking something also for the medication for this, but it only reduced my cholesterol for a time, and then it went up again. I am very active, and I like to do sports, different kinds of sports, and I thought that would do it. But so I thought, okay, I am going to join this and see what will happen with my cholesterol. So I registered. They took our blood the first day, and they said they would repeat it at 8 days afterwards. And I thought, 8 days? What is going to happen within 8 days, you know? So they fed us good food. I even learned how to eat beans in the morning. I used to eat that. That was new to me. And very nutritious food. At first, you have to kind of be in the thought of really wanting to eat what they serve, because that's not really exactly like what you do every day, eat every day at home. But I thought, okay, we have to prove that this is going to work, because nothing else worked anyway. They did hydrotherapy, they did all the treatments they could, and they have an excellent, excellent team that took care of us. And I just want to thank the use of your very beautiful facility here, open to the community. This is just great. I was going to attend this in Weimar, but you know, we got very busy and we never made it there. But I'm glad this was brought here, right here at home in our backyard. So when the first blood test came back, I was surprised. Not with the cholesterol, because I was expecting my cholesterol to be high anyway, but there was a item there that is CRP, and probably he will explain this to you later, right, Dr. John? CRP, my CRP was high. That is an index of inflammation in the body that says you're in danger because something is inflamed in your body. And I did not have any symptoms, and I could not feel anything. So I thought, okay, this must be a mistake. But the next day I was so worried about it, I knocked on Dr. John's office and said, I want to speak with you. And she said, sure. So the next day we sat at the breakfast conference, and he listened to all my concerns. And after that, he said, don't worry. After this, at the end of the session, we are going to take your blood and everything is going to change. I looked at him and said, really? And I believed him, but I did not trust myself. I thought, what will happen with these values after 8 days? This is not going to happen. Well, 8 days after, they drew our blood again. And lo and behold, I looked at they gave us the sheets, and I was just amazed at the result. Do you want me to just go through this? Just
if you want to mention a couple, sure, that would be great.
Very quickly, because if I don't read it from here, I could sort of memorize it, but if I don't read it from here, you think I'd be making the figures out, right? Okay. I discovered also that I have a first stage hypertension. My blood pressure was running 166 over 70, 165 over 80. At the end of the session, maybe 2 days, within the last 2 days, I was running 120 over 70. I even had a 110 over 55 in one of my sessions. And that's surprising. My total cholesterol was 250. At the end of after 8 days, it fell to 213. That's minus 37, a 15% improvement. My bad cholesterol, that's LDL, your doctor will tell you, was 141 start, and I ended with 124. That's minus 17, which is a 12% improvement. Now listen to this, triglycerides, 206. It dropped down to 139. That's a 67 point down, 33% improvement. Now, I was telling you about the CRP, the inflammation index in our body. I had an 8.99. The normal of that is 0 to 1. 8.99, it put me on the range of danger. And anything could happen to me any day. That dropped to 0.63, an improvement of 93%. What happened? This program works if we
Amen.
follow it. It's amazing what God can do if we're willing to be healed.
Now I want to go back to the PowerPoint, just a few minutes and we'll finish up. So I'd like to share a couple of quotes just before we have our questions. Here's a quote from Second Selected Messages, page 54, paragraph 3. If you're not familiar with this, I think you'll want to go read this, but she goes, this is I didn't want to quote the whole page, so I'll pull this out. For this reason, the Lord has marked out a way in which his people are to carry forward a work of physical healing combined with the teaching of the word. Sanitariums are to be established, and with these institutions are to be connected workers who will carry forward genuine medical missionary work. And then we read in Second Selected Messages, page 346, paragraph 4. And I'm telling you sincerely and genuinely, I cite this in prayer to my Lord oftentimes when I'm working with patients. Natural means used in accordance with God's will bring about supernatural results. We ask for a miracle and the Lord directs the mind to some simple remedy. So should we not believe and follow these counsels? Of course. In fact, here we read in Second Selected Messages 346, paragraph 5, we cannot expect the Lord to work a miracle for us while we neglect the simple remedies he has provided for our use, which aptly and opportunely applied will bring about a miraculous result. And then the next paragraph on the next page, therefore pray, believe, and work. And I just want to say that I believe that God has been faithful to his promise with us at Village in Berrien Springs when we conducted a lifestyle program by the church, in the church. Initially, this first one was for church members. The church is going to do another one in November, and the idea is to invite community members now. And I just want to encourage you and each one of my colleagues, let's put the Lord to the test and see if he will not pour us out a blessing. There be not room enough to receive it. So thank you so much. And I'm now happy if there's time for any questions. I'll be happy to try to answer them.
So yes, does anyone have any questions? I don't see any in the chat at this point, but feel free to unmute yourself and ask Dr. Kelly any questions.
I had a question about the COVID-19 treatments and the innate response being blunted, and hearing some studies that show that vitamin D can help that. Is that your experience?
Yes, that's a great point. And I did not cover vitamin D and its effects in this talk at all, Richard. But absolutely, there is good evidence that those with a lower vitamin D level have an increased relative risk of COVID. Though I have not yet seen a study, and I'm not sure we've had a chance to do it yet. I've not seen a study, however, that has actually done an experimental intervention and given people with COVID or infected vitamin D to see if it actually improves their outcome. I believe that it will, but I'm not aware of studies that have done that. But we definitely know that your risk of contracting COVID and having a serious infection are greater if your vitamin D levels are not in a good range.
Thank you. Yeah, my understanding too also is that vitamin D may indeed just be a marker for sunlight exposure, and certainly sunlight exposure may have other benefits aside from the vitamin D, and therefore better than taking sunlight rather than a supplement.
I totally agree with you, and I I wish I had the time and money. I would love to do a study, and I hope someone will, to answer that question, because it may turn out that the vitamin D level is basically a surrogate. It may be even a confounder, that it is actually associated with something that is improving our resistance to COVID. And until we do an intervention study, I don't know that we can answer that question definitively. But I actually agree with you. My recommendation for people with low vitamin D is sunlight. But I also, if they are very low, and I will recommend supplementation. I have to say, I am not sure that supplementation is as effective as natural sunlight to bring it up. But these are studies that are going to take time for us to do, and to find out.
Ricky, did you have a question?
Yes, thank you for your answer on vitamin D. I would like to ask a question regarding invested immunity. And I'm using invested immunity in the place of innate immunity, because innate really points to an evolutionary stance towards medicine that I think that we need to move away from. The question is hot and cold shower sufficient to awaken your invested immunity so that you can at least build up resistance against the exposure to COVID-19?
Yeah, that's a really good question, and I'm not personally aware of studies that would definitively answer that question. What I am aware of, and I do have these papers and information in my files, is that research has been done that shows that a contrast shower is capable of demarginating white blood cells, macrophages, lymphocytes, etc., natural killer cells, who, they more or less are parked along the vessel walls in normal situation, but a contrast shower then mobilizes them. It may have as many as 400% increase in circulating white blood cells after a contrast shower that can last for more than 24 hours. What I'm not aware of is any study, it may exist and I don't know about it, but any study that has shown that doing that affects your, what did you call it, invested immune function to be able to better fight off COVID or coronaviruses. I believe it would, but I have to tell you, I don't know of a study I can cite.
Thank you.
So there's a question in the chat. Do you have any idea from experience or studies of the relative contribution of hydrothermal therapy versus the other lifestyle therapies?
That's a really good question, and I'm sorry that I don't. The thing that I think the closest I have is studies looking at the effect of plant diet, whole food plant diet, and like say an Ornish or an Esselstyn kind of a program. We do have some measures that have been taken on immune function associated with a plant diet, low-fat plant diet. But I have not seen a study that has done any comparative effectiveness research or quantitatively compared them. It's just that we do have data that both diet can affect the risk and strength of avoiding the ability of the system to fight and avoid infection. And we also, of course, have the hydrothermal, hyperthermal therapy. I want to make sure that that's clear. I think I use the terms always properly, but sometimes you may not have noticed. I call it hydrothermal therapy when we're talking about the hot and cold, etc. But the studies that I cited about the effect on the immune function, the innate or invested immune function, were based on hyperthermal, meaning temperature elevation. there's very few studies. In fact, I haven't found any recent ones at all. By that I mean in even the last 20 years on alternating hot and cold for the immune function and viral disease. But we have some definitely showing that hot has a beneficial. I'm saying hot, but you realize that temperature was only 103 or 103.1 degrees. We're not talking about raising the body temperature a great deal. It only takes 2 or 3 degrees Fahrenheit to make a difference in the ability of the immune system to function, and the ability of the virus to replicate goes down as the temperature goes up.
Okay, so another question, could you speak to the potential risks of hydrothermal therapy aside from burn risk? For example, risk of immune suppression, like can happen with too much acute exertion compared to a regular conditioning program with exercise.
Yeah, that's a good point, and I didn't touch on that, but I'm glad you brought it up. Yes, I'm not again aware, I am trained, my MPH is in epidemiology, so I can't keep from thinking whenever I answer a question, okay, what is the science, what are the studies available? I'm not aware of a study that has looked specifically at this question, but there isn't any doubt in my mind, because we know that you can bring a person to exhaustion with hydrotherapy, especially with hot, but even hot and cold, and it's taxing to the system. And as you point out, we do know that physical exertion like exercise, but other things that bring the body to exhaustion can depress the immune function. And so absolutely, you want to keep these under control and make sure that we don't go to that point of exhaustion. Remember the one thing I did cite in this talk that touches on that, I think, is the results that Dr. Elliott documented in Life and Health May 1919 issue that were cited by Lorenz and Linneman. And that was 3 times a day, they were doing fomentations on these Spanish flu patients. And I realize Spanish flu is not the same as COVID, but it's the best parallel we have right now. And they were getting very good results. So that's been my experience, and what I've read in the work that I've looked at from Kellogg and others in the early days that were doing a lot of these treatments in the 1920s or so, was 3 times a day seemed to be pretty much the typical intensity. But I am sure, as you say, it could be overdone, and that should be avoided.
Is there anyone else who has any questions? Eric has his hand up.
Okay, I'm sorry. Just a quick question. I guess I'd like to know the difference between fever therapy and hydrothermal therapy, if there is a difference, and also its role in disease prevention and also cure. I know that before penicillin was invented, they used fever therapy for syphilis and other diseases, specifically polymyalgia rheumatica, I've heard can be cured with fever. So just, yeah, if you could speak to that.
Yeah, that's a really good question and area of discussion, Eric, and I appreciate the question. I'm afraid I'm not feeling very authoritative about the polymyalgia or some of the other things. I do know, however, that fever therapy, as opposed to hyperthermal therapy, I would say that hyperthermal therapy is a broader term, and it would include fever therapy, but it is not all hyperthermal treatment is what I would call fever therapy, because as I understand the term, and I'm not sure that it is actually perfectly and well defined and narrowly defined as we usually try to do in medicine. But as I understand fever therapy, this is where you raise the body temperature above what we've been talking about. You take it up to a point where you're trying to actually, in many cases, you're trying to kill cells that are malfunctioning, either cancer cells in the case of cancer, or cells that are infected with the virus. You know, that we want to heighten the cytotoxic effects of the T cells, etc. And so the body temperature is taken to higher levels. Above 103 is not from what I understand. But again, that I don't do fever therapy in general. That's not my area of expertise, and I don't have a lot of experience with it. I don't want to hold myself out as an expert, but that's my understanding of the difference there.
Appreciate it. Thanks.
And then in the chat, what was the percentage of fat in the whole foods plant-based diet offered at your program last February?
Yes, well, it's a good question, and we don't know the answer because we haven't done a actual analysis of the content, but we can tell you that what the intent is that we're aiming for a fat content that would be somewhere between 15 and 20%. So it'd be lower than the typical, but not really extremely low, like you would find with Ornish or McDougall, for example. And the thing that, so we don't know the answer, but I will say that we, in general, do not use added free fats, oils in the food. We will use fats though, because we use avocados, we use nuts, we use olives. So we're not trying to go for a no fat or very low fat. We're just trying to have what, like I say, somewhere in the neighborhood, say of 18, 20%. But it is not a major factor. I mean, it's not the main measure of what we're more interested in actually is we're more interested in having whole food, less processed. For example, we even just recently, my wife and I, we've been working on this and doing these interventions for years and been doing for diabetics for a couple of decades. And we constantly are trying to find ways to make the tasty food that has higher fiber and higher or less processed. So we recently, for example, changed our waffle recipe. And we were, in the past, we've been using a typical recipe that many of you probably have used, where you have sunflower seeds and rolled oats and salt, and you put it in water in a blender and you blend it, and then put this in a hot waffle iron, and steam will rise the waffle. It makes a very nice waffle. But we were trying to find a way to make the waffles not raise blood sugars as fast in diabetics as they often do. And we hit on the idea of blending the nuts and the salt and water, and then mixing old-fashioned rolled oats in it, sort of like you were making muesli, and let that sit for half hour. And sure enough, when we made waffles that way, it required significantly more chewing. It was the effect on the blood sugar was noticeably different. And so we're more aiming for, as I say, whole foods, less processed, slower digestion than some, specific amount of fats. I do believe, I mean, personally, I'm a total vegetarian or vegan by choice at home, but I actually think that a little bit of the Mediterranean style of food, I wouldn't care for the meat, but I think the Mediterranean diet has may fit the descriptions that we find in the Spirit of Prophecy better than a very low fat Ornish diet myself. But of course, everybody has their preference and understanding. And it's a good question. I really don't know what the amount of fat is.
Okay. Was there someone else, Stuart? Did you have your hand up?
Yeah, I just had a little comment about the thermal therapy. I'm not an expert in that either, but I had read something recently that alluded to a study that had been quite a while ago with actually, I'm not sure, it might have been done more recently. The thermal therapy for autism spectrum disorder, actually improving symptoms of autism spectrum disorder. And the
Oh.
mechanism which that was for that was actually through heat shock proteins, and which is the same mechanism, one of the same mechanisms that exercise can improve. But also, interestingly, cruciferous vegetables, the sulforaphane, also has some, interacts with some of the same mechanisms too. So you may have feed in there from different lifestyle factors. The effect wasn't long lasting, with the thermal therapy. It was only temporary, but certainly a nutritional change could help significant numbers, not 100%, but for people with that disorder too.
Yeah, thank you for sharing that. I definitely will make a note and do a little more digging there. One of the things I wanted to say is that it is seems evident to me from my experience, but this so far is only anecdotal. I don't have hard data, but it appears to me that there's a synergistic effect when you put all 8 of the natural approaches together. In other words, when you have a healthy diet, you have good sleep, you have all of the, and especially then when you use hydrotherapy. But there's a statement from Ellen White that is very pregnant with meaning, I think. And I'm sorry I don't have it right in front of me, but I think I can quote it very closely. But anyway, she basically says that proper diet can do more than all the baths that can be given, something to that effect. And so as important as I think hyperthermal treatments are, and we're using them, and the Lord is blessing, I think that we must never forget that a proper diet is one of the most powerful natural treatments. And so I'm not at all surprised at what you were saying there about the cruciferous vegetables and so forth. Yeah, thanks for sharing. I appreciate that. And I'll be becoming a little more knowledgeable about that in the next few weeks.
So just one more question that's in the chat. Can you explain what you think about the Mediterranean diet is better?
Yes, I suspected that comment might raise some questions. When you see, I like to think I'm science-based. I mean, before I was a Christian, I was a antagonistic agnostic. I thought that science and mathematics were the only source of truth in this universe. And I still think that logic and reason is an important tool that God gave us. But ultimately, we have to let revelation, in my opinion, help us discern, which so-called facts are real and which aren't. I mean, you can take any branch of science, but geology is a really obvious one, and they're continually changing their understanding of what happened 4 billion years ago, and so I think that I go with revelation. And so Ellen White was shown many principles about healthy living that she didn't even understand herself. I believe with all my heart that a little bit like Ezekiel with the wheel within a wheel, he really didn't know how to describe what he was seeing, but he did the best he could. And as someone, I think Stuart in his prayer said, now we are so privileged because we got so much better science and methods of looking at nature in much more detail. We're finding out how many of the things that Ellen White told us were healthy and were right. We're finding out how they work, and it's amazing. So anyway, where I'm going with this is that I believe that the Mediterranean diet is commonly understood in literature is closer to the diet that Ellen White described. She certainly didn't use that term. I don't even know if it existed back in her day, that terminology. But I believe that is a more closer description of the diet methods and foods that she said the Lord showed her that would be best. Whereas I think the very low fat diets, while they have their application in certain therapeutic situations, I don't think that for a healthy, lifelong diet, those are always best. I think a Mediterranean might be a better match. So I don't know if I express myself adequately or not, but I'm basically saying, I think my understanding of the revelation of diet is the Mediterranean comes closer to it.